Welcome back. Let's talk some more about COVID-19. And today we're going to go into the past and we're going to go into the present. And we're going to talk about some precedent for what we've seen. Uh, One of the big stories that I felt I had to tell in this class was that of the 1918 pandemic. We'll talk about what they did and the consequences from that. Another story which is related in several ways, including the fact that it was a pandemic, but also some ways having to do with equity and inequity um, with the HIV pandemic. We'll talk about COVID-19 again. This time we'll be focusing on where and how it spread and what we did about it. Um, and then I'll talk about effects on the economy. So the 1918 pandemic, we now think probably started in the United States. Even though it's called the Spanish flu, it probably only got that name because Spain was the only country that was accurately reporting what was going on. The rest of the world was involved in a world, well, many countries in the world were involved in a war, and none of them wanted to report the fact that more people were dying from this disease than during the entirety of the war. About a third of the global population caught the flu, and about 3% of the global population died from it. The first wave primarily targeted old people. By the third wave, it ended up targeting young adults 18 to 40. It created sort of an immune overreaction that caused them to die. And different cities in the United States responded differently to it. So Philadelphia is a famous example where they refused to postpone a massive rally parade that they had scheduled, and as a result, suffered one of the worst death rates of all cities in the United States. Some cities acted early and had a very low death rate, like New York City. Some cities acted but didn't keep it up, and so they had further waves that killed more people. So St. Louis is an example of this. And you can compare the average, the death rates for the various cities. Pittsburgh having the highest. There were some that were a little bit lower, and Minneapolis having the lowest. You'll see that there's this dual peak in most of these cities. People that relaxed too quickly on the lockdown. So the 1918 pandemic shows a couple of things. It shows how deadly these can be. It shows how different responses could lead to radically different consequences. Another thing that it shows is how there can be further ramifications. So we've had descriptions of the flu for more than 2,000 years. But the backbone of the flu, now that we've been able to reconstruct the 1918 pandemic strain, it turns out that the proteins that were used in it came up again and again in all subsequent flus. It never actually went away. It just became a little bit less virulent for a while, and then infected some bird. It mutated in that host, and then that bird came into contact with us again. This time in somewhere in China. With the Asian flu, there was multiple mutations. It became H2N2, so each of these refers to a protein, killed millions of people, or about 1 million people. 11 years later, yet another round of mutations led to what was called the Hong Kong flu, which killed another couple of million people and is still the flu that we're dealing with to this day, or at least the predominant flu that we deal with. 9 years later, a weirdly reminiscent flu from the 1918, reemerged in Russia. And so now, ever since then, there's been 2 strains that have gone around the world every year until 2009, when a pig in Mexico somewhere, the flu mutated in its body and it somehow made its way into the population. That one, there was no noticeable difference from the background mortality rate from flus, but now we have 3 different strains of flu since 2009 that pop up at different strengths every given year. Costs tens of billions of dollars every year and kills hundreds of thousands of people every year. So the genetic backbone of the 1918 flu has been with us for 102 years, still killing half a million people at the top end most years. It's an uncalculable, well, actually, you could calculate how many people have been affected by it. So that's the flu. I want to talk about AIDS and HIV for a second, because I think this is one of the other major pandemics that has affected the Western world, and it's going to be relevant to our discussion. So HIV is brutal. There's a pretty long asymptomatic period where it can spread undiagnosably. And then there's quite a bit of symptoms that might be reminiscent of other disorders, accompanied by some weight loss. By stage 3, there's lymph nodes that can be pretty big, pretty swollen. Then there's recurrent infections, diarrhea, unintentional weight loss, decrease of most body weight. But most people don't actually die of of HIV. They die of other opportunistic infections because it infects the white blood cells, which typically respond to other diseases. Most people tend to die within, well, untreated, you can die within 5 to 10 years. The Reagan Administration, the AIDS emerged in the gay population during the 1980s. Probably started earlier than that, but it came to the public consciousness in the 1980s as GRIDS, the gay-related immunodeficiency syndrome. The Reagan administration purposefully ignored it, thinking that it was affecting a particular subgroup that was alienated and disparaged in society. And so as a result, they didn't give any funding, they did not acknowledge it, they didn't give any resources, and probably were responsible for AIDS turning into a global pandemic, or at least had a huge impact on it, having a devastating impact on the gay population in the United States. It also ended up having a disproportionate impact on Black Americans. I'm not going to read this transcript. It's fucking it is bad. The press secretary of Reagan jokes about being gay, or being accused of being gay, rather than address the thousands, tens of thousands of people that were dying from a disease that was spreading in the country. The gay community realized that they weren't going to get sympathy in the mainstream media or by the Reagan or in the Reagan administration. So they found a photogenic young child, a teenager named Ryan White, who contracted AIDS in the mid-1980s through a blood transfusion, and then suffered pretty greatly through it. He was expelled and died a few years later. They used him as a poster child rather than any of the tens of thousands of adults, or of the adults that had received it from a variety of other sources. And so Congress in the 90s passed the Ryan White Care Act to try to give HIV treatment to low-income people that live with it, to provide for testing of blood transfusions and a variety of other resources to the HIV-infected community. The United States managed to bring down the caseload of HIV in the 90s, but by then it was too late. It had spread to Africa and to other parts of the world, and is now responsible for the deaths of millions of people, many of which don't know they're infected, many of which are infected through sexual transmission, sharing needles, blood transfusions. Now it's easier to take care of it in that there's antiretroviral therapies, which is possible to address. A thing that I didn't include here, perhaps is worth mentioning, is that in the early 1990s, there was this conjecture that AIDS was just going to go away. It was just going to go away. People thought that it would essentially kill the entire gay population and then disappear. It didn't, and because we didn't act on it, it's a disease that has ravaged lots of the world, mostly in sub-Saharan Africa, although elsewhere as well. Okay, on to a cheerier topic. I'm not sure any of this class is going to be cheery. I'll just try to have a whimsical attitude instead. So it's been about a year since the pandemic started. And initially, there were about a couple of dozen cases in Wuhan, China. Within a month, it spread from a couple of dozen to nearly 12,000 confirmed cases all around the world, including the United States, Canada, several Asian countries, several countries in Europe. Within a month, it surpassed SARS, the 2002 virus that had scared everybody because it had a 10% lethality rate, but it killed itself off. This disease can transmit without symptoms. You can have asymptomatic transmission, as I discussed in the last lecture, which means that it's in some ways much more dangerous than SARS. By February, it had spread to most of Asia, most of Europe, Mexico, Brazil, and Ecuador, New Zealand, and it had started having a foothold in Africa. It spread through all of the rest of Europe, most of Latin America, most of Africa, and Oceania in March. By April, we had 2 million cases, and it essentially had spread all around the world by May. You can see how the jump month to month from 41 to 12,000 to 43,000 to 700,000 to 2 million to 3 million could be scary, especially when deaths were increasing exponentially as well. Doctors got a better handle of it, and nations of the world worked to socially distance, to tamp down. By this point, it was too late to trace contacts in a lot of places. When the United States first had their first couple of cases, we could have followed them to see where they went. We didn't, and as a result, we've got millions and millions of cases all around the world, continuing to spread in the Americas. There was a second wave in the United States in the summer, although not elsewhere in the world. Continued spread elsewhere in the world. And by October, there was a start of a third wave here in the United States and a start of a second wave in Europe. The excess deaths due to COVID-19, we think, around the world are pretty extraordinary. Up to a third more deaths. In Ecuador, it's twice as many deaths as the average year. Some countries, like Iceland, like New Zealand, like Korea, managed to avoid everything, or at least the vast majority of the consequences. United States didn't quite fare so well. We're comparable to some of the worst. You can see that the Americas are pretty bad. Brazil may have had the worst response in the world. Just absolutely the worst, which maybe we'll talk about. But the European Union gave up taking care of this recently and are now facing a case rate that's much greater than they'd faced at all before. So what were we doing at this time as it started spreading? Early on in January, when we knew it was happening in Wuhan, we started screening people that were coming from Wuhan. The first case hit the United States and South Korea on January 21st. 10 days later, Donald Trump issues a travel ban to people coming from Wuhan and from other areas of China. There's lots of exceptions to this travel ban, and we evacuated a lot of people from Wuhan at this time, and didn't continue to follow them to see if they developed symptoms. We essentially brought the pandemic here ourselves. And then, rather than use the World Health Organization's testing kits, through reasons that are still mysterious, we decided to create our own testing kit for diagnosing COVID-19. It turned out to be flawed, and there weren't enough kits. There weren't enough protective equipment. There wasn't enough of anything. So we issued some limits to testing. And when we started noticing community spread, I left out the which I think it's going to pop up later. The urging people not to use masks, February 29th. By March 4th, we finally started widening testing criteria so we could see what we were dealing with. March 13th, we issued a national emergency. There were more travel bans throughout this time period. And at the end of March, after the stock market went off a cliff to levels below, essentially below some of the early periods in Obama's presidency. We passed this CARES Act that was a stimulus. The Federal Reserve released $1.5 trillion essentially on a whim to flood the stock market, and said that they were going to continue pumping money into the stock market without limit, which is probably why the stock market is still doing well. By June, we had tamped down the spread a little bit. We never got it down. New cases were still continuing, but people were getting tired. We had given $1,200 to a lot of the country to stay at home, but we hadn't used that time to give everybody masks. We hadn't used that time to develop robust contact tracing systems. And so people got tired. By June 20th, Trump began his first of many dozen rallies. A recent study by Stanford has shown that this has led to at least 30,000 extra infections in each of the towns he's visited, and at least 700 extra deaths in each of those towns. It's a bold re-election strategy to reinfect or to infect swing state voters. It wasn't until nearly a month later before Trump wore a mask for the first time, essentially admitting that masks were good after the initial statement in the end of February that the masks were not to be used. It turned out that the White House, the CDC, the Surgeon General were all lying to the public in order to preserve masks for the healthcare workers. This is a thing that we'll talk about in a future lecture about how science communication works. I think their motives may have been good, but it led to widespread skepticism of masks, exacerbated by our president. In early October, Donald Trump announced that he had tested positive for COVID, and several dozen people in his administration also announced that they had tested positive. But not since March had we passed any stimulus. So in May 15th, there was another stimulus act, realizing that most people who had been put out of work were going to have to go back to work in order to pay the bills. The ideal public health response to this would have included a travel ban. It probably would have included good testing kits. And it probably would have insisted on contact tracing on a massive scale early on. Some very clear public messaging throughout. And if it got out of hand, a lot of money to the public. Essentially, there's no... So sometimes in class, I get this question about where's this money coming from? We're paying for it in the future. But if we stop the economy, it would cost way more money. So the idea is you keep everything going, you pay everybody to stay home, get the virus under control, hire lots of people to trace anybody that is sick, and then get back to work. That would be the ideal. We didn't really do that. And as a result, aside from the health consequences, there's also some pretty severe and pretty dire economic consequences. When you look at unemployment claims over decades, there is a giant, sharp peak in 2020, the likes of which we'd never seen before. The unemployment rate is still extremely high. And these are people that want to keep looking for jobs. The economy went off a cliff, and it's continued to do so, and it probably will get significantly worse before it gets better. Unlike any other previous recession, we've had the slowest, most sluggish response, and one of the severest drops. There's all this talk about a V-shaped recovery, the idea being that it's a sharp drop, but a sharp increase again. But it might be that there's another drop coming. In fact, seeing as the cases are increasing and there's no stimulus coming, that's almost guaranteed. And there's millions and millions of permanent jobs lost. I think there's a sum total of about 11 million jobs that we think are now permanently lost, or at least the people that had them are going to have to find an entirely new line of work. And it's disproportionately affecting Black and Latino people. When you look at the percentage of the population that is working in these at-risk customer serving professions, it's Black and Latino people are disproportionately represented. They're also disproportionately represented in terms of unemployment. And it looks like there's no release or extra hazard pay coming for all of the populations that are facing the brunt of this. All right. There's a lot more to say, and I will say a lot more, but that's the end of this lecture. Have a good week. Good luck out there.